This is an example of an elderly patient with hip pain. The patient has had a previous arthroscopic surgery in the right hip, but the patient has left hip pain, and on the x-ray of the pelvis and proximal femurs, there's no evidence for a fracture. However, when you look at the tomo images, you can slice through the pelvis and hips front to back, and there's several things to note. The first is in the right hip, you do not see evidence of severe streak artifact as you would on a CT scan, showing the benefit of the digital tomosynthesis and the lack of the streak artifact, allowing evaluation of the bony structure surrounding the arthroplasty. In this particular situation, the patient has left hip pain, and I'm just going to zoom in on the image. You have clear evidence of a left subcapital femoral neck fracture, something that could not be seen on the x-ray images themselves. There's also a step-off here of the lateral aspect of the left femoral head and it extending into a fracture at the femoral neck. It's a beautiful image of an occult hip fracture by x-ray that's clearly visualized on the digital tomosynthesis. There's also images of the CT scan that we can visualize on this patient. Again, showing the left hip fraction, which was very obvious on the tomo images, not seen on the x-ray images, but then again seen here on the CT images. Once again, I would like to point out the severe streak artifact from the right hip arthroplasty that really obviates and limits evaluation of the adjacent bony structures, which was much more easy to evaluate on the digital tomosynthesis images. So for two reasons, the DTS images in this particular case were particularly useful.